Good morning, everybody. Well, there is definitely good news in this world. Yesterday, we saw the first shipments of the Moderna vaccine arrive in New York City. So this is really, really important. We already had the Pfizer vaccine, now a whole new second opportunity to keep people safe with the Moderna vaccine arriving. This is going to give us much more capacity. But it's also, again, a moment to appreciate the extraordinary effort that the scientific community undertook in the year 2020 to create these vaccines to keep us safe. Not one, but two now, and potentially more on the way. So this is really miraculous. It's something to appreciate that these really safe, effective vaccines have been created, and they're going to allow us to move forward. They're going to allow us to turn the page once and for all on the coronavirus. Now, we are underway with the leadership of our Vaccine Command Center. We're underway in the largest vaccination campaign in New York City's history. This is going to be a huge logistical operation, but already you're seeing what New York City can do and how New York City sets a very high bar. We're already vaccinating people at twice the national average. There's a lot of focus, there's a lot of intensity in the approach to make sure the maximum people get vaccinated as quickly as possible. So we need to do that. The logistics, the hospitals, the doctors, the nurses, everything has to be coordinated through our command center, but we also have to educate people. We have to get people comfortable with the vaccine. Obviously, very importantly, President-elect Joe Biden got the vaccine yesterday and showed the world that. I think that was a great act and very important. What we're going to do every single day is educate New Yorkers about the importance of the vaccine. And we're launching a new campaign to get the word out. It's solved very clearly, NYC Vaccine for All. The idea of this campaign is to let people know this is for everyone. This works for everyone. It will be free. It will be easy. It will be effective and safe. These are the messages that we have to get out. Safe, free, easy. We're going to keep saying that over and over again. And we have so many community leaders who are stepping up, making clear to people who listen to them, who trust them, that this is the right thing to do to protect every New Yorker, protect your families, protect yourself. We're going to not just talk about it, we're going to show through evidence, through the testimony of New Yorkers, trusted, respected New Yorkers, that this really works. And we're going to push back against misinformation. We know there will be misinformation. We know the rumor mill will be working overtime. We will get the message out using all types of media and different languages, whatever it takes to help people understand that this is the difference maker. This vaccine is what will allow us to move forward. All the pain, all the suffering, all the loss can be defeated through this vaccine. That's what we want to get across, and the best way to get the message across is for you to hear from everyday New Yorkers who have received the vaccine, and so they can explain why it's so important to them and their families, why it's so important to you. And so we've got three folks who work at health and hospitals, in our New York City public hospitals and clinics, who do such important work for all of us, who really are heroes for what they've done to protect their fellow New Yorkers. And we want them protected, but we want to hear their voices because they made the choice to get the vaccine, and it's important for you to know why and what it means for you and your family. So first, let's hear from someone who helps every day, the people of the Bronx. He works at North Central Bronx Hospital for our health and hospitals system, and we welcome Kevin Cruz. Welcome, Kevin.
How you doing?
I'm doing good today. How about you?
I'm doing good. I got my shot and I'm feeling good. No side effects, nothing.
Amen.
I work at New York City Health and Hospitals, North Central Bronx, and I've been here since 1978. And I was here at the beginning when AIDS was breaking out. We've been through, a lot of things here. We've never seen anything like this. This virus it's affected my family, my son, his wife, my stepdaughter, her family in Florida. It's, to me, not a matter of when, if you're going to get it, it's when you're going to get it, or someone close to you is going to get it. I don't consider anything that I do heroic. I consider that I'm lucky for working with heroes, the nurses, the doctors here, all the staff. they were incredible through this whole thing. The hours they put in, seeing them coming in, the way they risked everything. At the beginning of this, we didn't, no one knew whether you were going to go home. When you came on a shift, you didn't know if you were going to get out. You really didn't. You could see it in the people's eyes, the nurses' eyes, the doctor's eyes. You didn't know if you were infected. No one knew anything. New York seemed like it was ground zero for this, and there was a lot of training going on, and you can see that the people were doing the learning and going through it. I'm hoping that everybody comes to take the shot. To me, it's a no-brainer when you come in with the idea of, you don't know what the side effects are. You know what the side effects of COVID are. We were filling, refrigerated trucks with the side effects. We need to take the shots. We need to do what we've got to do. This is the beginning here. I count myself as lucky for having gotten the shot and lucky to be able to help these people who are dealing with it every day. Really, it's just hard to put into words what we've been through here. And when I hear people saying that the shot isn't safe, I don't know how to argue with them anymore. I don't know what proof you would need. Having been in this building during this time and seen what we've been through, I don't know what they're waiting for. I just think it has to be something that we all have to do.
Kevin, I really appreciate that, and I think you just gave all the reasons in the world right there. I just think you spoke from the heart about what we saw, what we know, and I really appreciate the point you made. People worry about side effects. We know the side effect of getting COVID, and it's how horrible it can be. We know that can lead to people losing their lives or lasting consequences. So I want to thank you for putting it in real perspective, that this is something that people need to do, and do it for yourself, do it for your family, but also do it for the healthcare heroes who were in harm's way but fought through to save us. Kevin, thank you. That was very, very powerful.
Thank you very much.
Thank you, and thank you for all you do. Everyone, I now want you to hear from someone who does so much for us in Queens. Suja Mohan is the Director of Nursing for the Emergency Department at Queens Hospital, another place that was right in the epicenter of this crisis. Thank you for all you've done, and tell us what you think about this vaccine. Suja. Can we hear?
I'm the Director of Nursing for the ED at New York City Health and Hospital, Queens, where I have worked for the past 10 years. I witnessed what this virus does to people's bodies firsthand, and not just older at-risk population. Young, seemingly healthy people were becoming critically ill from COVID-19, and it was terrifying. And still, healthcare workers, my teams included, heroically rolled up their sleeves and saved lives, putting themselves at risk or isolating from their families for weeks at a time. I was eager to be one of the first hospital workers to get a COVID-19 vaccine, not just because of what I experienced during the surge in March and April, but because I believe in science. Science tells us that this vaccine can help slow or end this pandemic. It can help prevent people from passing away without their loved ones by their side. It can help make healthcare workers less afraid of their job or of bringing home the virus to their families. This is what the pandemic has been like us in hospital for nearly a year now. I urge everyone to consider getting the vaccine and do their very own research, turning to trusted scientific outlets. You can also speak to your healthcare provider with questions or concerns. This is our best chance to help end this horrible pandemic and save lives. Once again, I urge everyone to get this shot of hope. I thank you.
Thank you so much, Suja. Thank you for all you have done through this pandemic to save lives, to help support all your colleagues. I know it's been really tough, but thank you for your leadership and thank you for your testimony today on how important this is. I want you to hear from one more New Yorker, and this is someone who watches out for the people who do this crucial work, watches out for our healthcare workers, watches out for folks who are in hospitals and need solace and comfort and support. Very, very crucial that we recognize that all the members of the clergy who are there for people in their hour of need help sustain us and have helped to sustain us through this horrible time. So he does his good work at Coney Island Hospital, part of Health and Hospitals, a place that also really, really struggled and fought through the worst of the coronavirus crisis, and really appreciate his leadership and his voice today. My great honor to introduce Rabbi Jonas Brunswick.
Good morning.
Good morning, Rabbi.
Good morning. My name is Rabbi Jonas Brunswick. I'm one of the chaplains in New York City Health and Hospitals Corporation in Coney Island Hospital, where I provide spiritual support throughout the pandemic to patients in the ED, ICU, and any other unit within the hospital. I'm not a scientist or a doctor. I'm lucky to work with the people here at Coney Island Hospital. I made the decision to get the COVID-19 vaccine by relying on the clinical judgment of medical professionals and my doctors who understand the ability to fight off the virus and to keep us all safe. Given that the doctors have been fighting this virus and saving lives throughout this whole pandemic, they trust the vaccine and they're taking it themselves. I think it would be very wise for everybody else to consider, like the doctors do, getting this injection virus, the vaccines against the virus as well. I decided to get the COVID-19 vaccine to be able to continue my work providing spiritual care to people in and out of the hospital. Also, to protect my family, my loved ones, my congregants, my patients, hospital staff, and anybody else I come in contact with. I took the vaccine because I don't want to get the COVID-19. I certainly don't want to give it to anybody else. Thank you.
Thank you. Rabbi, thank you so much. That's such a clear, powerful message. You don't want to get COVID-19 and you don't want to give it to anybody else. Well, listen, everybody, the rabbi said it about as clearly as you possibly could. This is why everyone should take this vaccine, because Lord knows you don't want to get this horrible disease, and you certainly don't want to pass it on to those you love. So we're going to keep giving you the opportunity to hear from your fellow New Yorkers in the weeks and months ahead to really understand why people believe in this vaccine and their own personal experience with it. I think that's going to be what's most compelling to people. I really want to thank all our guests today for all they do for us and for also helping New Yorkers to understand this vaccine and believe in it. Now, today we're going to talk about a couple more things, but they all have to do with saving lives. And this is a season where we really focus on our blessings. This is a season of reflection, and it's a season of thankfulness, and it's also a season for giving back. I'm asking everyone to help in every way they can the fellow New Yorkers in this season. And one of the things that's most important to do to save lives is to give blood. And we've talked about this over the last few weeks quite a bit. There is a real challenge in this city with our blood supply, because all the normal ways that we normally maintain our blood supply, the corporate drives and colleges, government offices, all the times that people so kindly give blood to help others, that all isn't happening the same way, and we've got to make up for it. So we started a Give Blood NYC campaign to really help people understand this is something you can do. This is a life-saving thing you can do, literally life-saving. And just make it personal. If it was one of your loved ones rushed to the hospital and they needed a transfusion, there was no more blood, you know that would be heartbreaking. We can't let that happen. So this is why everyone needs to come forward and help. I went and gave blood at the New York Blood Center with my wife, Charlene. We were honored to do so, to help our fellow New Yorkers. Now, people have been responding. Thousands of people have responded to this campaign. I want to thank, there's almost 11,000 people this month who have come forward to give blood in New York City. Thank you. Thank you all for what you're doing for your fellow New Yorker. But we need more. We've set a goal for the month of December. We need 14,000 more donors by December 31st. Now, we only have 10 days, but we can do it. New Yorkers can do it. But we need everyone to step up right now. This is, again, you think about how can you give back in this season? If you're thinking right now, what can I do? How can I help the world? This is what you can do. It's simple, it's fast, it's safe, and there's locations all over the city. All you have to do is sign up at nybc.org/givebloodnyc, nybc.org/givebloodnyc. You will be saving lives literally. So please, we need you now. All right, now talk about saving lives. Vision Zero. Vision Zero is a difference maker for now 7 years. We put the most aggressive approach in this country into place to save the lives of pedestrians, cyclists, and motorists. And Vision Zero has worked, and Vision Zero is powerful because it changes behavior, it changes minds, it changes laws, it does so many things, changes the way that our streets look and feel and their safety. There are so many parts of Vision Zero, and I believe in it, but we have to go farther because we know there's still too many people in danger. There's still lives that are being lost that should not be lost. So this year we've seen a very, very painful reality. And obviously the coronavirus, the number one challenge, has thrown off everything else. Now, one thing that is true and is a very good thing amidst this very painful year is that for pedestrians, this has been our safest year. 2020 has actually been our safest year for pedestrians, but not for motorists and cyclists. There have been too many crashes. In fact, we've seen that rate go up in alarming fashion. We have to do some different things right away to address this situation. So we have new Vision Zero initiatives we're launching. Some will be done by the city. Some will need the help of the state of New York. And we're appealing today to New York State, to the legislature, to help us do more, to help us save lives, help us with the most fundamental step, which is taking what works. Speed cameras, they work. And let me say, anyone who hears the word speed cameras and they immediately don't like that, they don't like to hear those words, speed cameras remind them of tickets they get. I can sympathize, I've said it before. I've had moments as a driver where I wasn't careful enough and I got one of those speeding tickets and no one likes it. But you know what? They change behavior. They get people to start slowing down. They get people to obey the law. They work. And we need more because we need to save lives. What we need is for New York State to allow New York City to operate speed cameras 24 hours a day, 7 days a week. We still have too many restrictions holding us back from saving lives. And these restrictions don't make sense. Remember, most basic fact in the world, if you're not speeding, you're not going to get a ticket. Let me say again, if you're not speeding, you're not going to get a ticket. If you're not speeding, you have nothing to worry about from a speed camera. So extending them to greater hours only makes sense, particularly the overnight hours where we've seen, unfortunately, some really horrible moments and people's lives lost. We're also going to be cracking down through the police department on drunk driving, which we know is a challenge in every holiday season. We're really worried about it this season with such a horrible year people have been through. So you're going to see the NYPD out in force addressing drunk driving and making sure people understand there are real consequences. But when it comes to the speed cameras, I want to just make sure people understand this. And these facts speak volumes. 3/4 of traffic fatalities this year happen in times or places where no automated speed enforcement is currently allowed under state law. So right there's a problem. And over 1/3 of the non-highway fatalities occurred in school camera zones during hours when the cameras could not issue tickets. So think about that. In those school zones, we fought hard to get those cameras in the school zones. They work. They've saved the lives of kids and parents and grandparents. They work. But even in those school zones, we're seeing people's lives lost because we can't operate those cameras enough of the day. Doesn't make sense. It's time to change the law. We know there are colleagues in Albany ready to lead the charge, and we thank all of them. This is about saving lives. So I want to ask everyone to support this crucial Vision Zero initiative. Let's use the speed cameras to the maximum to save lives. Okay, one more quick point before I do our indicators, just a update for people in the Bronx today, that there is a special election today in the Bronx, an open seat for the City Council in District 12. Now that includes neighborhoods of Baychester, Co-op City, Edenwald, Eastchester, Wakefield, and Williamsbridge. Polls are open. They've been open since 6 a.m. They will be open till 9 p.m. So it's a special election. It's important for the community to be represented. And even though we know it's not the same focus and energy of a typical election day, I still want to reflect on how just weeks ago, New Yorkers came out in droves to make their views and voices heard. So I'm asking folks in the 12th Council District in the Bronx, come out, make your voice heard, make sure you are represented. Polls open until 9 o'clock today. All right, let's go over our indicators. Number one, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 193 patients. We want to be under 200. We're barely under 200. But again, the hospitalization rate per 100,000 is a problem, 3.09 per 100,000. We want to be under 2. So again, that number is too high. Case numbers continue to be astoundingly high. Today's number on 7-day average, 2,889 against a goal of 550. It speaks for itself. We have a lot of work to do. We got to bring that down. And now the third indicator, percentage of New York City residents testing positive, 7-day rolling average today, 5.88%. We want to be under 5% even. We have real work to do. 5.88%. A little lower than yesterday, but still higher than we need to be. Few words in Spanish. Lo único que nos va a dar de nuevo la oportunidad de tener una vida diaria normal es la vacuna. Por eso, todos debemos tomar la vacuna que es segura y efectiva, y convencer a nuestros familiares y amigos a hacer lo mismo. La ciudad más grande de América va a ser más fuerte si todos atendemos el llamado para vacunarlos y derrotar este virus para siempre. With that, let's turn to our colleagues in the media, and please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're joined today by Dr. Choksi, by DOT Acting Commissioner Margaret Forgione, and by Senior Advisor Dr. Jay Varma. The first question today goes to Allison Caden from Pix 11.
And good morning to you. I want to talk about holiday travel. My first question is, some New Yorkers may be listening, some New Yorkers probably aren't, whether that means getting in their cars, going to the airports, they're going to see friends, going to warm locations, going to family. They will eventually have to come back to New York City. What is your message to them?
Thank you, Allison. Couldn't be a more important topic. First, my message again, you heard it from Dr. Dave Choksi, our health commissioner yesterday. If you have travel plans right now, cancel those travel plans. If there's any way you can. Look, some people, I know it may be literally an emergency or something that they don't have a choice. If you have a choice, cancel your travel plans. Why? Because we finally have the vaccine. In a few months, it's going to be widespread. Things are going to be a lot safer. Postpone your travel to when it's safe. Protect yourself, your family, your loved ones. But let's say someone says, no, I'm traveling no matter what. Okay? Then I say to them, you've got two choices. One, when you travel, of course, you have to maintain social distancing with people around you, wear your mask, do all the things we normally tell you to do. But if you're going to come back and expect to go on with your regular life, that's not going to happen unless you do exactly what the state rules say, and you test while you're away and test negative and come back, and within the stipulated period of time, test again and test negative. That's the only way you're not doing a quarantine. And right now, that's a 2-week quarantine. And we will enforce that quarantine. We'll follow up with every traveler about their quarantine. We expect them to honor the quarantine. We'll help them. But if they don't honor the quarantine, there are serious financial penalties. And we need people to understand that. We're not doing this for the fun of it. We're doing this to save lives. So don't travel, ideally, but if you do travel, get ready to quarantine. Go ahead, Allison.
My follow-up question, obviously, is this concerning strain in the UK. A lot of travel between London and New York. We've been talking about this for a few days. Still, it doesn't seem like the federal government is in any rush to stop UK travel. Have you had any talks with the federal government, with our federal leaders, and what is your concern level?
My concern level is high, Allison, because we're looking at a new strain that is more infectious and simply makes the job harder, just when we're about to be able to turn the corner. So I believe in a travel ban from Europe at this point, a temporary travel ban. I believe in at minimum, if there's going to be travel, requiring a negative test for anyone who gets on a plane. I'm going to be talking to a variety of federal leaders to try and get it done. Obviously, we have not seen much receptiveness from the Trump administration. We'll keep trying, but if we can't get it done now, we're certainly going to try and get it done under President Biden. But yeah, I'm worried just because it leads to more spread. Let me have Dr. Varma jump in here and just help people understand why this presents a new challenge.
Great. Thank you, Mr. Mayor. And I want to just re-echo the comments that you made, which is that we have always known and been worried about travel as a threat to our ability to control this infection. So the more that we can do to limit the amount of travel that's happening, and for people who do travel, ensure effective testing before and after, as well as isolation and quarantine, the better we can do to slow the spread of this virus. Now, specifically regarding this strain, what is most concerning to us is are really two things. One is the fact that the evidence from the UK is reasonably strong that this virus spreads more easily than other strains of the coronavirus. And so again, that means that our room for error is even less. Everything that we do to prevent infections, keeping distance, wearing masks, washing our hands, we need to be even more rigorous about. So that's one concern. The second concern is we are seeing other strains, not the same one, but similar types of strains emerging in other parts of the world, like in South Africa. And all of that, again, is an indication that the only way that we can really return back to some version of normal is to reduce the number of people infected. This virus mutates when it's inside humans. So we need to keep it out of humans. And again, so it circles back to the same thing, really being very strict about all the precautions that we normally follow. And we're going to be looking very carefully for introductions of this virus here in the U.S., as well as the possible emergence of similar types of strains. It's something we need to be wary about. But we do have the tools to prevent this. We have a vaccine, and we have all of our individual measures.
Thank you. Go ahead.
The next is Michael Garland from the Daily News.
Good morning, Mr. Mayor.
Good morning, Michael. Are you ready for the holidays?
I am. I apologize. I've got the television on in the background. I hope it's not too loud. I've got the kitty crowd control going.
We want to support you in your crowd control efforts, so that's okay.
I wanted to ask you about going back to the DOI report on the protests. Commissioner Shea said to the news yesterday that it really didn't seem to paint the full picture of what was transpiring. He was commenting on the DOI report. I think his issue with it was it didn't kind of put things into the full context. And I was wondering, do you agree with that assessment? Do you think the report should have done that better? Just in general, what do you think of the commissioner's comments on that? Do you agree?
Let me be very clear, Michael. I said it really from the heart on Friday. I agree with the report. I agree with what Department of Investigation did. I agree with their analysis. I agree with the recommendations. I think it is clear that we all needed to do better. I needed to do better. Commissioner Shea needed to do better. The leadership of the NYPD citywide and down to the precinct level needed to do better. I also said there were some areas where I thought the report, I wouldn't have said it the same way, and I think there were things that needed some more acknowledgement. But that's small compared to the real truth of this report. It is a fair report. I think it is a tough, clear view on what happened, and it makes clear we got to do better. So I 100% accept the report. And the commissioner said very clearly that he accepts the recommendations and will implement them. Go ahead, Michael.
Thanks, Mr. Mayor. A lot of people have asked you about when you'd get the vaccine, and we've seen some elected officials getting it. I wanted to ask you another question about that. Once you do get the vaccine, what do you plan to do? I mean, differently when you get it? Do you see your behavior changing much? Are you going to be out and about doing things you haven't done since March? What do you got planned once you get it?
It's an important question. I think we all need to just keep being careful because it's the smart thing to do in this moment that we're all going through here. So what I've found is that the basic health rules we've all been following make sense, and we want to keep everyone in that mindset until we really have widespread vaccination. Want to keep wearing those masks, keep the social distancing, the small gatherings, all those things until our health leadership says, okay, it's time to change now. It's time to relax and approach things differently. Look, we've said we think it's going to be roughly till about June before we can get really, really widespread vaccination. I think every week is going to get better, Michael, but I'm saying if you say when you're really going to be pervasive in New York City, probably give or take June. I'd say from now to June, we should all keep to these basic precautions, and then we'll assess as we get to that point, and we'll listen to our healthcare leadership. But in terms of how and when I get the vaccine, I am ready, willing, and able, and Dr. Choksi is going to tell me when it's my turn in line.
The next is Marla Diamond from WCBS 880.
Good morning, Mr. Mayor.
Morning, how you doing?
Good, how you doing?
I'm hanging in. Just a few more days to Christmas, so I'm feeling good.
Right. I got a couple of middle schoolers here who are eager to get back to the classroom. Any guidance on that and on high schools when you might give us some sense of when the older children will be going back to school?
I would like them back in school as quickly as possible. What I can tell you right now is we're going to look at middle school first and then high school. Right now, we got to fight back this second wave, obviously. We've got to get this vaccine distributed widely. We're going to start looking at January as a first opportunity for middle school, but it will all depend on what's happening with the larger healthcare reality and what our healthcare leadership is saying. So we've got more work to do, but I am very anxious to get our middle schoolers back as you are. I can't give you a date yet. It's going to need some more time, but my goal is as soon as humanly possible. Go ahead.
And just to follow up on the vaccine, you mentioned at the beginning that you were very hopeful about the Moderna vaccine. Do you have any idea when that might be coming to New York City and who will be getting it?
Absolutely, and we have a lot of idea. And it's the fact that this is on the playing field right now, the Moderna vaccine, and that's huge. And Dr. Choksi will go over with you, the kind of number of doses we expect and the impact we think it's going to make. Go ahead, Dr. Choksi.
Thank you, Mr. Mayor. And yes, I certainly share the excitement about the Moderna vaccine. A really important point that distinguishes it from the Pfizer vaccine is that it can be stored in regular freezers which means that we can expand the points of access and distribution beyond places that just have that special ultra cold freezer. In terms of the timeline for arrival and distribution, actually, we got our first few doses of Moderna vaccine yesterday. About 25,000 of the approximately 149,000 that we expect for this week have already arrived in New York City. Those, along with the Pfizer doses that we're receiving as well, will continue to be distributed according to New York State prioritization guidance, which right now focuses on healthcare workers, particularly healthcare workers who are at highest risk, as well as nursing home staff and residents. And we're looking forward, as you heard from my amazing colleagues earlier in the call, we're looking forward to getting it to as many people as will benefit from it as quickly as possible.
Thank you. Go ahead.
The next is Nolan Hicks from The Post.
Oh, hi. Sorry, you caught me in the middle of nuking a cup of coffee.
Well, Nolan, we want you to be well caffeinated.
There's really no other way to live, Mr. Mayor. How are you?
I'm doing well. I share your view.
To circle back to the DOI report real fast, can you say specifically what parts of the report or what conclusions in the report or what pieces of it you disagree with? You've hinted at some disagreements.
Yeah, Nolan, I don't think disagreement is literally the right word. I think the importance of the fact, for example, that we were able to make sure that the National Guard were not brought into New York City. It's referenced in there, which I appreciate, but I think it's a very big deal. The fact there was no loss of life, which tragically occurred in many other cities. Many of the more extreme policing tactics that other cities resorted to were not used here. The kinds of things that really we felt were so important to avoid using. And I just feel like when you read the report, it rings very true. And that's what I appreciate about it. But I think some of that context should have been emphasized a little bit more. Go ahead, Nolan.
Secondly, to the questions about policing tactics, the police department for weeks denied the fact that it was kettling protesters. They had a similar strategy. It was called encirclement. Do you think that was appropriate? And to follow on that point, there were many reporters over the course of May and June who described those tactics to you. You frequently dismissed those reports, most infamously telling Gothamist's Jake Offenhart's, I believe you believe what you're saying. Do you regret those comments?
I think actually, Nolan, I wouldn't call that infamous to say I respected that someone believed what they were saying. And I did respect, I like Jake, and I think he's a very earnest person. But what I got was a lot of different information that suggested different realities. And what I needed was an objective analysis, a thorough analysis, because I wasn't taking anyone's word for it. Bluntly, I want to be really clear about this. Didn't take NYPD's word for it, or someone who opposed the NYPD's word for it, or anyone in between. I wanted an objective analysis of what happened, and that's what Department of Investigation provided. It is clear that tactics were used that should not have been used. They will not be used again. There should not be kettling. There should not be encirclement. As someone who has been in protests many a time as a protester, every peaceful protester deserves the opportunity. If they want to leave the protest area, they must be given that opportunity. If arrests are imminent, there must be clear, constant reminders that that's about to happen. If folks choose civil disobedience, want to get arrested, that's great. If they want to move away, they should be given that opportunity. We don't accept and allow kettling or encirclement. You will not see it in the future. And if any police commander utilizes that tactics in the future, they will experience discipline and consequences. Go ahead.
The next is Dana Rubenstein from the New York Times.
Hi, Mr. Mayor.
Hey, Dana, how are you?
Fine, thank you. So you've stopped elective surgeries at HC hospitals. Case numbers are, in your words, astoundingly high. Is the state waiting too long to shut down as it arguably did last time around?
Dana, it's such an important question, and it is something we are all talking about every day. I've had numerous conversations with the governor. My team, his team have been talking constantly. We have, I think, a complex situation here. The case numbers are astoundingly high. I don't like what I see one bit. I'm really worried. And we are seeing an impact on our hospitals. At the same time, we are seeing our hospitals handle these cases much, much better than in the spring, and with much better outcomes. The governor's presented a plan that really focuses on the hospital issue because that is the single most sensitive and crucial issue, and I agree that that's where you begin, and we are seeing better outcomes in the hospitals. But there's also the worry that as the case numbers continue to grow, you have the challenge of the spread of this disease and the question of what will stop it, what will slow it down until we get the vaccine really to be widespread. And those bigger restrictions are the only tool we have. So we keep assessing daily, we keep having the conversation with the state daily. And I think particularly if we see more stress on the hospital system, that there is a likelihood you will then see those restrictions. Go ahead.
Thank you. And then secondly, does the extension of unemployment benefits in the new federal stimulus, does that impact your thoughts on the matter at all, given your concern about people being able to hold on to jobs?
It's a good question, but I'll tell you, again, I really, you're asking the question with a whole heart. I try to urge people not even to call it a stimulus because it's not a stimulus. It is, barely a survival plan. It's short term at best. It will not help us turn things around in a substantial way. The amount of direct aid, I'm glad there's direct aid, but the amount of direct aid is so small that for many, many New Yorkers, people all over the country, it's not going to make much difference. So no, it does not make me feel that, that's going to tide people over, everyone's going to be okay. No, I do not feel that. I think we always are concerned about protecting people's livelihoods. I'm really concerned about folks who are trying to save their jobs, save their businesses. That matters. But of course, what matters most is protecting people's lives. So we're trying to balance all of that. But no, I don't think what happened in Washington gives me much solace. Go ahead.
The next is Ben Ivansky from Fox News.
Hello, Mr. Mayor. Thank you for taking my question. First question, will you follow Joe Biden's remarks yesterday and give credit to President Trump's administration for getting the vaccine out in such a speedy way?
Yeah, look, I have many criticisms of President Trump in general and specifically his handling of the coronavirus. But I've also been very comfortable saying when I think they did something right. During the worst of the crisis, March, April, May, when the president himself and the people around him helped us to get some of the PPE we needed and supplies we needed, I made it a regular point to thank them and give them their due praise for the ways that they helped New York City. I'll also always say when they failed to help New York City. So, in terms of getting the vaccine, yes, I do think the president and his administration contributed substantially to getting a vaccine in this kind of time frame. That's a really good thing. I would also say, they dropped the ball profoundly in the beginning of this crisis and exacerbated it throughout with their actions, with their words, and also failed to provide us a stimulus, which obviously the president could have been the difference maker on. But if you're saying, did they play a valuable role in getting us a vaccine quickly? Yes, I do believe that. Go ahead, Ben.
And second question, last week there was a report about an exodus of NYPD officers leaving the force. Is that something you're concerned about?
Look, there's a lot of good veteran officers who've contributed a lot to this city and have made the decision to leave, a lot of them for obviously financial reasons, but other reasons as well. And I do honor the service they provide the city. But I'll also tell you there are thousands and thousands of young up-and-coming New Yorkers who want to serve in the NYPD, who represent every neighborhood of this city, every background, who bring a lot of energy, a lot of skills, and we're going to be welcoming them into the NYPD. So the NYPD is going to be strong in all scenarios. And one thing we know, there's always plenty of good New Yorkers who want to serve their fellow New Yorkers through the NYPD.
We have time for two more for today. The next is Yehudit from Borough Park 24 News.
Hello, good morning, Mr. Mayor. How are you?
I'm doing well. How are you?
Good, thank God. We want to thank you for all your beautiful Hanukkah wishes last week, and also wish you happy holidays this week.
I appreciate that. I always appreciate you have a good energy about you, and I thank you for the good work you do.
Thank you. Thank you so much. Well, my question is actually about an unfortunate recent surge of incidents. This was a couple of weeks ago, coming to Borough Park, and they were actually running out of their cars and trying to scare children and adults as if they were going to attack them. And then I'm sure you saw that, I think you wrote on Twitter that there was unfortunately some vandals who spray painted a swastika on a girls' high school. And then also, I think it was a week or two ago, somebody from our community saw some anti-Semitic graffiti in a subway station, and while they were just taking the subway. And I'm sure that you remember the devastating anti-Semitic murders and tragedies of last year's Hanukkah in Brooklyn and Jersey City and Muncie. And you said then that you really wanted to help fight anti-Semitism, and this is obviously always on our minds. And you said there was so much more to be done. I was just wondering what your perspective is in terms of police presence or anything that can be done to patrol the streets of Jewish neighborhoods, just to be aware that this is always on our minds and always an issue.
Thank you. Thank you for the question. We've got a lot to do. We've been doing a lot, but we unquestionably have a lot to do. And look, it's such an important topic. The first thing I want to say is, on a very human level, I have met many Holocaust survivors in Brooklyn. And I often talk about very painful moment that I experienced, sort of another moment of realization on top of everything else that I had always known, at a Shabbos dinner when a woman who had been in Auschwitz rolled up her sleeve, and my family was with me to see this. We were at Assemblyman Dov Hikien's house, this was years ago, and his mom rolled up her sleeve and the numbers from Auschwitz were there on her arm. And my children saw that, and it was very affecting to them. So the reason I say that to you is when you talk about someone scrawling a swastika on a yeshiva in the year 2020, whatever that person is thinking, they don't for a second understand what that symbol fully means. The horror of the Holocaust and the fact that people right now in our city live through that. And when they see that swastika, what horrible pain that causes them, and the memory of those they lost that surges through them. This is not ancient history. This is history we're living with right this moment, all over the world. And I'm very troubled by what I'm hearing in Germany, where you see neo-Nazis having more and more of a role again. This stuff is very real. So right here, the message is to constantly spread the message of respect for the community, embrace the idea that in New York City, the Jewish community, all communities will be protected, and that police presence is crucial when needed. And many, many times that has helped us to really ensure that nothing like this happened again. But it's also education. And I think one of the things we were starting to do before the pandemic was really go deep into the school system and do education about the Holocaust, about the Jewish community and Jewish history, and also other communities that have suffered discrimination. We've got to get back to that. I think it's one of the things we'll be able to focus on again when we finally turn the page on the coronavirus. Go ahead.
All right, great. I just wanted to respond before I ask my second question. I wanted to quote Benjamin Netanyahu, who said that when people tell us that they want to kill us, we believe them. So it's really about police presence. And And that's just really something that's a concern. But you've talked a lot about loans, grants, and other help for small business owners, and you're asking New Yorkers to shop the city. And I know, just speaking for myself, I think shopping online, especially with future lockdowns, is going to be a really hard habit to break. And I think one thing that could really help, because I speak to a lot of business owners in the community, are help with websites, because a lot of us are not so tech savvy, and that could be something that I think can really, to make, instead of trying to compete against Amazon, I was wondering if the small business services would ever be able to provide technically savvy people to help small businesses to create websites so that people can keep shopping online, because I don't know if that's really going to be something that people can stop doing.
That's a really good point all around. First of all, I'm happy to tell you, yes, we're doing that already, but we should be doing a lot more. I want to take your point and run with it. I'm asking all New Yorkers. I know a lot of people are still doing holiday shopping. I certainly am. So I want to say to all New Yorkers, shop local, shop your city. I hear your point about folks may be tempted to, for health and other reasons, do all their shopping online, but you can still shop from local stores online to the maximum extent humanly possible. But I think it's a really great point. So Small Business Services is already doing this, but I think they should do more and deeper into communities. I'm going to ask our Small Business Services Commissioner, Janelle Doris, to follow up with you about how we can do a special outreach into Borough Park and other communities. But yeah, this is exactly something government can do to help people, provide that technical expertise, show people how to set up those websites. Let's keep these dollars right in the community. So however you shop, shop local this holiday season.
Last question for today goes to Juliet from 1010 Wins.
Yay. Happy holidays to all on the call. Merry Christmas, Mr. Mayor.
Merry Christmas, Juliet. Hi, are you done all your shopping?
No way.
All right. I like that. That was a badge of honor right there.
Yes. Now, you know what? I'm baking. I think people are getting home baked goods.
That is the best present.
That's not done yet either.
That's the gift of love, yes. Juliet.
Thank you. Thank you. Actually, I wanted to ask you about stimulus money or lack thereof, because in the short term, with your preliminary budget due next month, what are your plans for city services and personnel? Because Politico today is reporting that city agencies have to cut 3%. So is that translating into service cuts, personnel cuts?
We have a big challenge ahead. What's happening now with our budget is we're getting ready for a presentation in January. We're turning to all city agencies and saying you're going to have to find more savings. This is going to be a version of what we call a PEG, which is an effort to get savings from every agency. What has been put out there initially is simply to get ideas and proposals back from agencies. It's not the final plan by any stretch. That will be developed for the presentation in January, but then there's much, much more after January, in April and June. The big X factor is what I hope and believe will happen, that President Biden will come in and really focus on a serious, large stimulus. But until we know that, we have to prepare for the worst. So this year's budget, thank God we're doing okay from now up till June, but next year is very, very tough. And that's why we're saying we have to be ready for anything and everything. We're going to ask every agency to put forward savings ideas. Unfortunately, we have to, again, talk about something no one wants, which is layoffs, but that's going to be part of the discussion again, unless we get federal or state help. So it's a very sobering moment. And certainly this bill, again, I will not call it a stimulus, this bill that was passed in Washington did not change the equation in any big way because it just didn't provide the kind of relief that we need to turn the corner. Go ahead, Juliet.
Okay, so how long do you think you can hold off on layoffs? And if or when the stimulus money does come, what are your priorities with it?
So, first of all, so far we've been able to avoid layoffs with a lot of help from labor, defraying some costs that we would have had to spend this year, some of the things we would have had to address this year. That's been immensely helpful. I want to thank our labor partners for that. And we've had some other revenue we were able to get. We've been doing okay so far. But there's so many unknowns here. There's revenue that we need that if we don't get, could put layoffs and other cuts back on the table even for this year. But certainly if we're talking about next year, the next fiscal year starting in July, unfortunately it is a live possibility because there's so many missing pieces here. Over $4 billion whole minimum going into July. And I just want to put in perspective, Juliet, in the spring, the House of Representatives passed a true stimulus, a true, substantial, muscular stimulus that would have helped cities and states get them back on their feet. That was the spring. Here we are now, this week, we get something much, much less. It's really disappointing, and it just says to us, get ready. Because if we don't get help from the federal or state government, we're going to have to make some very, very tough choices, painful choices, and choices that actually will make it harder for us to recover. I don't want to do that. I want to try and avoid that at all costs. But right now, all options have to come back on the table because we haven't gotten the help we need. Everyone, look, as I conclude, and that was a sad note there, but I want to go back to the positive, especially in this holiday season. The positive really comes from the voices of our good colleagues at Health and Hospitals that you heard earlier, the incredible work they're doing, the people all over the city who were there for each other, who helped to save lives, who stood up, who just showed amazing compassion. I want to thank everyone who was there for us, every healthcare hero, every first responder. I had the opportunity yesterday to send out a thank you with Shirlane to all city employees that just do such good work, and you've all been heroic. I'm going to be using the word heroic a lot going forward because that's the story of 2020 in New York City, and you all did that heroic work. And now, here's another chance to be heroes. Let's go out there and get everyone vaccinated. Let's show the world how well we can do that here in New York City, how fast we can do it, how much we can protect each other with the vaccine. And look, we're going to keep telling people it is safe, it's easy, it's free. And when everyone gets vaccinated, this city moves forward. So let's start building our future right now and get everyone in the game, off the bench, in the game, helping us move forward. Thank you, everybody.